Michelle, what is biofilm and how does it develop in flexible endoscope channels?
Biofilm is an accumulation of microorganisms and organic material that forms a matrix, and it forms in endoscopes because of repeated rounds of exposure to patient material. And then there is the reprocessing, the cleaning, the disinfection, and dry storage. And with those repeated rounds, you'll get an accumulation or buildup of biofilm within endoscope channels.
What is the importance of correctly cleaning endoscope channels?
Correct cleaning of endoscope channels is absolutely paramount, and it requires the use of an appropriate detergent that will effectively remove or solubilize the organic material and the bioburden so that it can be removed with brushing and flushing of the channel. Without adequate cleaning, there can be failure of high-level disinfection, the subsequent step, because if you don't remove enough of the material, it's too much of a challenge for the subsequent high-level disinfection. And if there's failure of high-level disinfection, you can get contaminated scopes and biofilm buildup.
So can failure to clean endoscopes potentially lead to infection transmission?
Failure of cleaning has actually been shown in several of the outbreaks that have occurred to be what was thought to be the basis of the contamination in the scopes. In other words, they weren't cleaned properly, therefore high-level disinfection failed, and that resulted in surviving organisms that ultimately were shown to infect patients. So definitely there is evidence that's been published saying that the inadequate cleaning of flexible scopes actually resulted in contamination of the scope and subsequent transmission of the organism to patients that resulted in them having infections.
What recent incidents and outbreaks have been recorded?
There have been published documented outbreaks throughout the world. Whether it is in Europe or in North America, there have been several outbreaks that have been published, and that's just the tip of the iceberg. And I think the interesting thing is it's not just duodenoscopes. The focus in the United States right now is on the problem with duodenoscopes, but outbreaks have been documented resulting from contaminated colonoscopes, gastroscopes, duodenoscopes, you name it. Those types of scopes have been associated with infections in almost every country in the world.
In your opinion, is there sufficient monitoring today of flexible endoscopes?
The monitoring of endoscope reprocessing is, in my opinion, very inadequate. The steps that are the most likely to be done incorrectly are the cleaning steps. There are rapid cleaning monitors that are available, but because they're not a requirement in the guidelines, many countries have not implemented them. And I believe it is really important that sites offering endoscopy do not really know how clean their scopes are if they are not monitoring. So I think that there is a gap and that there should be a requirement for monitoring of manual cleaning to ensure that if the scope is not clean, it doesn't go for high-level disinfection, it gets re-cleaned again, and I think that would reduce the risk of inadequate cleaning leading to failure of high-level disinfection. So I think there should be more monitoring done of the manual cleaning step.
So what, in your opinion, are the main improvements to be made specifically with regards to biofilm?
In my opinion, the main improvements that are really needed in endoscope reprocessing occur in two areas. The first area is the cleaning, the manual cleaning step, and the need to ensure that there is an adequate detergent solution and that there's adequate brushing and adequate cleaning and rinsing done. That is the step that is most commonly done incorrectly by the humans that are actually doing these procedures, and it's not their fault. There's a lot of pressure in the clinics. There's a high demands put on them to get the scopes turned around in a very short period of time, and I think it's important that there is monitoring so that you can be assured that the cleaning has been done properly. And then the second step, in my opinion, is the dry storage, that you really need to ensure the scopes are stored where the channels are very thoroughly dried so that biofilm, which requires moisture and organisms, so biofilm cannot accumulate within those channels.